is Marika from Hemisphere, and today what I want to talk to you about is using an overhead press in pregnancy. Now, I have seen recently some people suggesting that you shouldn't do overhead presses if you're pregnant. I think some of these sort of fears came by because people are concerned about the abdominal wall and maybe the pelvic floor, and in some exercises, if you hold your breath, there might be too much of that valsalva and that increase in blood pressure that can occur during exercise. Now, if you want to do overhead press and you're not having any issues with the abdominal wall and you don't see any bulging through that linea alba, through that separation, then actually for most people an overhead press is actually fine in pregnancy. And certainly from my perspective, I actually want to encourage some strength in an overhead position because sometimes mums actually do lift overhead. And for those of you who are parents, mums or dads, I'm pretty sure most of us at some point have thrown our babies in the air or lifted our babies up and given them a big smile and a wave. So we actually do want to develop some strength through that range. How do I modify in pregnancy? I do tend to reduce the weights once we move overhead, especially towards the latter stages of the pregnancy. I also tend to cue women to breathe out through the overhead section. Now, this might help bring in a bit of reflexive pelvic floor lift, and also to stop women from holding their breath through the exercise. So I've got a few little bits of equipment here that I can show you. So one is just a basic bit of TheraBand. You've all seen me use TheraBand before. I tend to go about 1.5 meters with my TheraBand, but you can just pop it behind the shoulder blades here and just do a push-up exercise. And you can add some different leg variations or single arm techniques as well if you like. If you have normal hand weights, you can do simple overhead presses, so doubles. You can do reciprocals, so one's going up, one's going down. I do tend to use it with a split squat position where I go down and then do an overhead press on the way up. So that's a nice little variation there. I do also like to use kettlebells with my pregnant population, and this is a 6 kilo baby. I say baby, probably equivalent to about a 3 or 4 month baby. So again, we need to have some strength for mums. So what I'll usually get them to do is do a little squat and then an overhead press. Now this one I'm a little bit cautious with, and it depends on the people in my class. Some I will just get to do the squat part of the exercise. For those who are a little bit earlier on in the pregnancy or who have actually done some weights before, I will add that overhead press as well. But it's going to depend on the person in front of you, what their exposure to exercise has been like, and whether or not they've got any of that separation in the abdominal wall. Okay, so another thing you can do is use something like a Sandbelt. With this, I tend to do a little bit of a disco dance. So what I'll do is I'll do an alternating squat. So one knee bends and then a press overhead as well. And it's just to bring in some of that asymmetry, that crossing the midline. There's lots of sort of fun things that you could do with that. And I use that in a class situation too. So this one's only 2 kilos. So most people can actually manage that quite well. The last thing I've got here is just a Slamball. This one is 3 kilos. So again, it's about the size of a newborn baby, albeit a slightly smaller newborn baby. So there's lots of variations that you can do with this particular piece of equipment. And again, you could just do a slightly off stance overhead press. Depending on the strength and control, you could do a single arm. Lots of variations there. So I think the key things with pregnant ladies, don't be afraid to do overhead presses. Just watch for the abdominal wall, make sure there's no bulging come up through there. Try not to hold your breath during the exercise. Use an exhale and pelvic floor lift through the more strenuous part of the exercise, and have a bit of fun. Vary it up, use different bits of equipment, and yeah, have fun. Thank you.